Good morning, everyone, and welcome to the Rural Health Transformation Advisory Council. I would like to call this meeting to order, and I'd like to thank you for joining us and for your willingness to serve in this important role. This council brings together a broad range of experience, perspective, and community voices, and your participation is essential to shaping the future of this project. As a reminder, the purpose of this advisory council is to provide structured, informed, and directional recommendations to the commissioner regarding the design, oversight, and continuous improvement of the Rural Health Transformation Program. The department recognizes that Alaska's rural health system is highly interconnected and that advisory council members may be applicants to the Rural Health Transformation Program or have professional affiliations with organizations that are applicants, partners, or stakeholders. These relationships do not preclude service on the advisory council, but they do require awareness and transparency as we conduct our work. Members are expected to disclose status as an applicant or relevant professional affiliations to the department in a timely manner, and members are expected to disclose possible direct personal benefit to themselves and or family members to the department. And the department will review potential conflicts on an ongoing basis. Before we begin, just a few reminders about how we operate. Our meetings will follow informal Robert's Rules of Order. When the steering committee needs to take an action, we will use a simple majority vote among members. And because we are meeting virtually, all votes will be conducted by roll call. This meeting is being recorded and will be posted online after the meeting is concluded. We will begin this morning with roll call, and we will start with the elected officials serving on the committee. For those who are watching, my name is Emily Ricci, and I am the Deputy Commissioner of the Department of Health and act as a non-voting chair for the committee. So starting with elected officials, Senator Giesel.
State Senator Kathy Giesel.
Representative Mina.
Representative Genevieve Mina, present.
Jared Cosen will be joining us in a few minutes. Mary Wilson.
Present.
Niels Andreasen.
Present.
Monique Martin.
Good morning, present.
And Nancy Merriman.
Present.
Okay. Nearly all members are present. I think there's one more who will be joining us, and we do have a quorum to conduct business. So I want to move on to the next item on the agenda, which is approval of the agenda. This agenda was provided in advance to advisory council members and has been publicly noticed. Are there any requested changes to the agenda by advisory council members?
I have one suggestion.
Mm-hmm.
I appreciate that the agenda includes many really important updates and informational items, but I didn't see any specific questions or issues on which the department is asking for the council's advice or guidance. So on future agendas, I would just encourage you to include the questions that you would like us to weigh in on so that we can come prepared to the meetings.
Thank you. That is great advice. I appreciate that. And I think as we move forward with the advisory council, some of the meetings may be more informational in nature for outreach and awareness, and others we may have specific questions or asks. But that's an important call out to add to the agenda regularly. Thank you. Any other items or considerations for the agenda today? Okay. If there are no objections, the agenda will be approved. Hearing none. Oh, it is approved. So approval of the minutes. The minutes from our last meeting were distributed ahead of time, and they are also posted online. So does the committee have, or does the council have any amendments to the meeting, amendments or changes or corrections to the meeting minutes? Okay. If there are no further corrections, the meeting minutes will be approved. And hearing no objections, the meeting minutes are approved. So now we'll move into the portion of the agenda focused on department updates. And I know one area of intense interest is the letters of interest. So I would like to invite Betsy Wood. She is the Executive Director of the Office of Health Savings to provide an update on the letters of interest process. Betsy?
Thank you very much. Hi, everybody. I'm Betsy Wood with the Office of Health Savings and wanted to provide a quick update. Some of this may be discussed in more detail a little bit later during the process and timeline portion of the agenda when we move into new business. But we just wanted to kind of remind everybody where we are now and level set it as to the work ahead of us. As a reminder, we received nearly 1,800 letters of interest from organizations across the state that are interested in participating in the Rural Health Transformation Program. From mid-March through mid-April, the Alaska Community Foundation, which has been serving as the Department of Health's grant administration partner, conducted the initial intake, eligibility screening, and high-level preliminary review of all of these submissions. Currently, the letters of interest are undergoing an in-depth manual review process by the Department of Health. And we'll talk through this process a little bit more later when we move into new business, as well as the timeline. And we'll hear from our partners at the Alaska Community Foundation as well about their part of the process. I just want to reiterate, though, that this process includes thorough evaluation by both Department of Health leadership and subject matter experts, and that's expected to continue through April, through the end of this month. Once we complete our review, we will communicate the outcomes and next steps for the letters of interest back to the Alaska Community Foundation. At that point, ACF will re-engage directly with applicants to provide status updates and share next steps with those individuals that submitted the letters of interest. So moving along this timeline, we expect that organizations will begin receiving letter of interest response notifications in early to mid-May. For the organizations that will be advancing to project implementation, they'll be directed to a full application submission through the ACF applicant portal, and we're aiming to open that in mid-May for approximately 3 weeks. I really just want to say, on behalf of the Commissioner's Office and the entire Rural Health Transformation Program team, we were incredibly impressed with the robust response to this opportunity and really recognize the magnitude of work that went into this process, went into submitting these letters of interest. We asked our community partners to really rise to a momentous task in a compressed timeline, and we really appreciate the work that went into that. And we also appreciate the patience and the flexibility that our community partners have shown as we navigate through the administration of this grant. And I'll pause and see if anyone has any kind of high-level questions. Again, as I mentioned, we'll be talking through this in a little more detail as we move into the timeline and the process overview, but just wanted to provide that brief update now.
Senator Giesel?
Thanks. Just a question, Betsy. The information that you just shared am I permitted to let my majority caucus in the Senate know the progress that's being made, or is all this information confidential?
That's a great question, Senator, and please do share. We've updated our website, which I think is one of the next pieces that I wanted to call attention to for the council, that we have put this information online on our website. And the meeting materials for this that also include kind of an overview of the process and a little bit of a visual timeline. Those are all also posted on our website too, to share out this information. But yes, please do feel free to share that.
Thank you.
Representative Mina?
Thank you. Thank you for the update, and it's great to hear about all of the different LOIs and the work that ACF has put in. I'm wondering if there's going to be a standard for how we're updating on the status of the LOIs and future awards. Will they only be at this advisory council meeting, or can there be some sort of expectation for a lot of applicants who might have been wondering what was going on with the application and waiting for status updates?
Thank you for that question. I think that one of the things that we've, as we build out this process and as we kind of grow our team, we know that it is really, really critical that we have clear communication out to our partners and out to the public. And we also have to balance that once we're reviewing these letters of interest and kind of moving through this, we are in that deliberative process right now where we're looking at this entire body. And I'll tell you that this is a monumental task. We were, again, floored by the responses, by the volume of responses and the quality of responses. There are, I'm truly impressed by the amount of fantastic ideas that we've seen coming in from across the state. But your question really is, how are we going to be communicating this out to the public, and what's that cadence going to look like? I think now may be a good time for me to highlight a few of the guests that we have on the call today. We've been building up our team. I have Allison Miller, Trisha Franklin, are two of our two new project coordinators that are working on this work with us. We also have Lauren Hughes joined us this week as a project coordinator, and we also have a fourth project coordinator. His name is Matt Dungan, who is rounding out the team. And I'm thrilled to say that we are now kind of fully staffed with the program team that is fully dedicated to not only the administration of this program, but to building out that public outreach, to communicating with people who are interested in knowing what's the process, where are we, what are the status updates. So I think I say this to introduce the team so you can see them, and also know that as we build our capacity, I think that cadence of how we communicate out to the public will be increasing, and we'll be providing as much insight as we can into where are we at any given time. I think I would say we always tell people to please watch our website. We do try to keep that updated, and I think that's a great kind of aggregating resource, but we're also working to build out, regular email updates to let people know either what's going on in the letter of interest process or to provide additional information about the program as a whole. We, in addition to kind of building up the team that can help to communicate status updates, we are working and have kicked off what we're calling the RHTP Impact Series, which is a series of kind of focused 1 hour webinars looking at each initiative and pulling in subject matter experts and leadership from across the department and across the state to really kind of dive into, okay, what do we mean when we're talking about workforce? What do we mean when we're talking about healthcare access, and to kind of continue to keep the momentum going on the policy side. But I have already seen feedback from members of the public, from members of this council, with ideas and suggestions on effective ways to kind of share the status of where we are, and then as well as we move into this program, to kind of share some of the wins and highlight some of the really good work that's going. So that's certainly a more robust public communications campaign is under development.
Representative Nina, did that answer your question, or do you have additional?
I guess I just have a
details?
thank you, and thank you, Betsy, for your robust answer. And it's good to hear that the Department of Health staff for RHTP is fully hired. I guess my question is will there be a difference in how you communicate the LOIs between applicants and between the public?
Yes. I think that the individuals that submitted, or the organizations that submitted a letter of interest that are waiting to see, well, what about my letter of interest? What's the status for me? That's communication that will be coming back. And Alex, if you want to share any insights into this, either now or when we can run through the presentation later, I think that may be helpful. But there certainly will be responses back to each applicant to say this is the status of your letter of interest. We are advancing, or kind of whatever the outcome may be for that letter of interest. So everybody that's submitted will receive kind of an individual response, rather than just a general department from the Department of Health that says the Department of Health is at our review stage. Alaska Community Foundation has completed their initial portion. So there will be that personalized response.
Thank you.
I would also like to note that we've been joined by Jared Kosen for the meeting minutes. Sorry. Do we have any other questions? Okay, I know we'll get into more as we dive into the presentation a little bit later on. The next item on the agenda is to talk about the regional planning, or was ironically the Rural Health Transformation website update. So I think we touched on that already. Betsy, do you want to add anything else? And then we'll see if the council members have any questions.
I think I'd just kind of again reiterate that, the information that we're sharing today, we're trying to put that online so that there's a place that people can go and take a look. I think that as far as ways for individuals to stay notified, they can, you can sign up for updates to see when that page changes, but I would also recommend people sign up for the listserv. And I think that we'll be sending out an update to individuals who have signed up for that listserv and maybe aren't just frantically refreshing the Department of Health website every day to see if we've made a change, to kind of share this update as well too, to say, here's where we are, here's what to expect and what should be coming next. So look for that this week.
One other thing to note is I think we've redesigned a little bit the Rural Health Transformation Program website so that we're breaking it up into a little bit of smaller chunks so it's slightly easier to navigate. And as we move forward, I'm sure that structure will continue to evolve. But if there's ideas you have on how to make things easier to navigate, we appreciate that input. Any questions for Betsy on the website update? Okay, next item on the agenda is regional planning.
Nancy.
Sorry.
Yeah, sorry, I didn't see you.
That's all right. No worries. I really appreciate the changes and the improvements in the navigation of the website. We've been hearing some comments about that, and so all of that is really appreciated. The other thing I wanted to just commend you on is thinking about finding that sweet spot between full and complete updates and no updates. And I think that it looks like you've made some updates to the website just in the last couple of days about the LOI status, and people are really hungry to know where you are in the process. So even brief status updates more frequently is really appreciated.
Yeah, thank you for that feedback. I think that's really helpful for us too, because you're right, it is a balancing act where, especially in this first year, where the timeline is so compressed, I don't like to harp on this because I don't want it to sound as though it's an excuse, but I think that we all would have maybe been breathing a little bit easier had we been given even a 6-month planning period would have been nice, or some a little bit of runway to do some of the planning ahead of time so that we weren't engaging in the concurrent planning to the degree that we are, but that is where we are. And I think that as we do this, we're trying to balance, to your point, Nancy, providing information that is evolved and is robust and is complete, with also wanting to give people updates more frequently. And I think what we've been hearing from this group and from others is that those more frequent updates would be very welcomed. And again, now I'm thrilled to have additional resources to help us continue to provide those.
Any questions or comments on this? Monique.
Thank you. I sort of wrestled with really kind of building off of what Nancy said, because I think it's really incredibly important, and almost because of that short runway, unfortunately, that CMS has given the state, communication is almost more important, because when you're talking about the type of award Alaska received, and the speed at which everyone is, like, especially I think the Department of Health, right? I think you guys are working at warp speed, but that lack of information causes a little bit of just uncertainty about where everyone's going. So I think those shorter, briefer updates, even just a couple sentences, a couple sentences would be really powerful for folks. Sorry, I'm about to sneeze. So I just really encourage, as you kind of have staffed up now, to really do that, because I think that's feedback that Nancy shared that we get regularly as well from a variety of applicants. So anything that we can do to kind of help with that, I think would be great.
Thank you, Monique. I'm in full alignment. I think that we'll be putting as much out as we can, and providing more constant updates so that people can know what we're doing, where we are, what they should expect next. And we really do hear that.
Any other comments or questions on this item? Okay. Moving on to the next item, regional planning meetings. And Betsy, do you want to describe the regional planning meetings? And I would also note that the committee and the public, there's a handout on both regional planning meetings and the impact series that were provided as meeting materials. So again, more information will be coming online. There's information already for impact series. More will be coming online for the regional planning meetings, but there's a little write-up there. Betsy, do you want to talk through the regional planning meetings?
Certainly. Thank you. So as we begin, the process of kind of allocating and distributing the funds, particularly in year one, as we kind of start off on this journey together, we thought that it was really important to bring regions and communities together to begin to identify gaps, flag priority areas, and really discuss opportunities for alignment. I think something that we've seen even in the our January convening that we held in Anchorage and other meetings that we've had. And as we kind of look through the great ideas that have come in, we see so many organizations that are thinking similarly, which is fantastic, because I think that shows that we really are, the challenges that we're hoping to address and the solutions that we'd like to pursue really do seem to be aligned in a lot of areas. And we think that moving through this regional planning process is a great opportunity for us to kind of highlight opportunities for alignment and to kind of support conversations where organizations can identify those themselves as well. And when we look at what are we talking about, when we look at, well, how do we identify gaps, or what do we do this, we're thinking, as you look at a region, it may be helpful to say, is access to dialysis a really large gap in this particular part of Southeast Alaska? Or are a number of people in this other community flying out of their community because they don't have access to an ophthalmologist? Trying to kind of have community conversations to start to identify areas where we can make some changes that can really improve what the healthcare landscape looks like in different communities and in different regions. And we think it's important to kind of create a space where we can help identify those shared areas of access gaps, or build out strategies that regions or communities can focus on, because it gives us a little bit of a center, or a little bit of that kind of that guidance as we think about how do we best leverage these funds across the state over the next 5 years. This is, you hear community and regional planning and you think, well, how are you defining regions? What regions are you going to? What communities are you going to? And really, as we've started to build this out, we've tried to kind of build out focuses on areas or regions by looking at health referral patterns. So some communities or regions are very closely linked, like Juneau and Southeast Alaska, while others may be a little bit more isolated. I'm thinking, Kodiak is an example. What we've been doing as we've kind of built out a list of areas where we would, hope to go, or like to go, or offer to go, we've been reaching out to across those communities to try to identify local lead entities in those regions or in specific communities that can help organize and coordinate these events. I think every community is at varying degrees and levels of coordination and planning already, and we're really not trying to bring in, we're not trying to recreate wheels, right? We're not trying to bring in extra processes that don't build on what's already occurring. So that's where we're trying to be a value add rather than something else that exists alongside some of those planning efforts that may already be underway. We are coordinating these meetings between now and September is about the time frame that we're looking at. And our very first of these meetings is kicking off next week in Seward on Thursday, or on Wednesday, followed by Kenai on Thursday, and then we'll be up in Fairbanks on May 5th. We're still working through timing and kind of space location coordination with a number of other communities. So I think those are the three areas where we have, our dates more specifically identified. But as a number of you who have been participating in building out this community and regional planning process with us and juggling schedules, realize that getting the right partners together at the right time is something that just takes a little bit of coordination on the front end. So with that, I would say as we're working to schedule out these information or these meetings, you can see kind of a sense of where we hope to be, where we plan to be, where we're working to understand if there's interest in us supporting in the meeting materials in that handout, which you have in your packet, which is also posted online. I think kind of speaking about the website updates too, we are planning to build out an area of our website where community members and providers and Alaskans can go to understand where is the department holding these meetings? How can I get involved? If I can't attend my meeting, how can I, the meeting in my region, because it's summer and it's hard to plan schedules, how can I still provide feedback? So we'll be building out more information there. I do want to note this is an area where these meetings are really intended for community members, not for vendors or outside organizations that are trying to market their wares, that are trying to come in and say, please buy my thing. We really think you want to buy it. We really are meaning this to be grounded in our local communities with our local community members that are here. So I say that to just flag that as we build out the materials for what is posted online, again, everything I feel like in this program is a bit of a balancing act. We're trying to ensure that we can build participation at the local level. So that's where when we put information online, we want to really clearly communicate the intent and the purpose of these meetings so that individuals who are interested in them can understand, is this something for me where I fit and I participate? Am I a local community member providing care in this community? Or, is this maybe not the right venue for me to engage? So, be watching for that. And Mary, I do see you have a question, but there's one last thing that I want to say on this, which is that these community and regional planning meetings, these are part of the approach to the overall program that we built into our application. These are milestones that we need to hit in this first budget period, in this first year. And the intent as we look forward into the future for the program is to revisit this process in year 3. Kind of come back into community, do a bit of a temperature check. Say, are we still this is where we started in the first year. We're now in year 3. Does this still ring true? What progress have we made? Where do we still need to go? So this is something that we'd expect to see come back around again in a few years. And sorry, I said that was the final thing, but there's one more final thing, which is at the end of this, we are working to produce kind of a report on the what was discussed at these meetings, what was shared, what information the department brought. We're trying to look at what data is available, building on resources that already exist. So many communities already have varying layers and levels of community plans, strategic planning, and we're really trying to pull these pieces together, as well as some of the health outcomes data that's available on the front side that we can see. So we can say, here's a bit of a snapshot and a picture, and let's take this and kind of help have a community conversation about where are we and where do we want to go. So there will be a report that will be produced after these meetings conclude, and that of course would be available publicly as well.
Mary?
Yeah, hi. And so actually that last point, Betsy, was sort of what I was thinking about, which was data. And two aspects of data, more of a clarification and a comment. So
broadly, the data will point toward need in the regions for these regional planning is what I'm hearing you say. And I think that's a great idea. And I think clarity around the regional data, what you're looking at, what you have, maybe links from the website so everybody's looking at the same stuff. And I don't think that's an easy job, but to the extent that it can be approximated, I think that would be really helpful for regions to know where they're going. And then and the links and also the impact of the work that gets done. The clarification is, I assume some of the grantees will have proposed collecting data and they're going to be doing some of that work themselves. In addition, though, I would imagine that the program is collecting data that they're trying to see an impact on, like you mentioned, dialysis, et cetera. Well, have you thought about how that's going to work? I think it's going to be really important for the data to be used in both directions, so you know if you're successful and all that. And I know I'm telling you something you already know, but it's not clear to me the central aspect of the data and the peripheral aspect of the data.
I think that's there's a couple of questions or a couple of layers in there, right? And so one is when I think around like kind of the community planning effort, I think what we're trying to provide on the front side is a little bit of a landscape of, we're not going to pull on every data source, right? I mean, I think that just given the timing of this, we are doing our very best, but I'm sure there will be many pieces that we're missing. We are trying to work with entities and community to say, like, is there a specific, data set that you look to? What are your, what are your metrics? Where do you find your targets? Can we make sure that we're pulling that in, and kind of doing that? So I say that to say that what we provide, I'm sure, will be a great starting point, and it won't be perfect. And it's certainly something that can evolve. And I think that kind of sharing that out so that we can all kind of start with that and then track that kind of body of kind of data pieces. A lot of it that we're looking at are data sets that feed into some of the metrics that we developed for our application, where we said, okay, how do we think that we're going to be able to measure kind of overall program success as we move? So I do think that there's a component of looking along the lens of that regional planning at how does this, what do we see from a data-driven perspective in different communities, in different regions, and how does that evolve over time? And that's certainly something that we'd like to watch and continue to build out and continue to provide information on how that's evolving. And then I think there's also an aspect that you brought up around kind of that overall program outcomes and kind of overall program impact. And that's where, I think we'll be looking to identify a contractor that can help us with that. Because I think, from where we sit at the program level, there's certain reporting that we know that we need to provide back to our federal partners. We talk about concurrent planning a lot, right? They have, CMS has issued kind of, here's what the programmatic reporting will look like for rural health transformation. Here's what we're going to be asking states to report back on. They want to know, how are we, spending our funds across the various allowable federal, like program allowable uses of funds. So we know that we'll need to collect that information from our subgrantees and report that back. But we're approaching kind of our overall program outcomes from that lens, where we want to be able to meet our reporting requirements for CMS. But we're also really looking at, like, how can we tell the story of the overall impact? And when we look at some of the, even the metrics and the milestones that are in our application, I think are really important and will be really helpful. But I think that there will be a significant body of work that is, in addition to that too. And so we're certainly, aware of that need to build out the kind of overall program outcome storytelling off of the data and progress that we see subrecipients making. So that's certainly a place that we're looking to pursue.
Yeah, thanks.
Our elements for the regional planning meetings. I think the first is that we are sending information to participants ahead of time, just to have them grounded. I think there's a combination of a video and maybe other information so that everyone can be kind of grounded. We envision these to be, one-day sessions no longer. So we need to be very efficient with our time, especially if people are coming together. So we want to share information about the program background, just as a reminder to get everybody up to speed, and also the data that we've looked at. And one thing that I will be really interested to see coming out of these meetings is if the data sources that we are looking at in coordination with them, if those actually reflect the experience of what people in regions and communities experience in terms of their large gaps, because the data doesn't always reflect the experience. And so that's why it's so important to get that feedback at this part of the process.
Yeah, and then are the activities that people choosing to do, are those that impacting in the way that they think? And that whole, you know that already, but I think tracking that's going to be actually really great.
And challenging.
And hard.
Yeah. And as Betsy said, the proposal was designed to be competitive and to identify metrics that we thought we could consistently measure over time. Those are important, but those don't always reflect the metrics that as a state or as a community or as regions reflect what we want. And so I think one area that I would seek support from the advisory council in the future is going to be looking at those metrics to identify, okay, we know what we have to do for the application, but what else is important to us as a state that we want to measure for this process? So I anticipate that being a future conversation with the advisory council this summer, and I'm hoping the regional planning can help give insight into that as well.
Monique, I see your hand
If I could, thank you, Betsy. So there's a lot to unpack in all of that. And I think with regional planning, I think the one thing that would be helpful, right, is how do we make sure, like, how are these being identified for the public? And I think one thing that will be really, what I would suggest that we consider is something on the department's website, something in that email, and something in a public notice, right? Because no matter how hard we try to let people know about these regional convenings, we're going to miss somebody. So I think it's really important we give Alaskans every opportunity to participate in these and identify that they want to do something, that they want to help, that they want to participate. So I also really appreciate your comment on vendors. I don't want these rooms that are often small in rural communities to be taken up by people that are really not intended for these meetings, and that they should really have a connection to the providers, the community, if they're going to be participating and, as you said, not selling their wares at these meetings. I think that, so I really encourage us to list those so people can raise their hand and say, I'm interested in collaborating with a state to host these. And I'm glad to hear the conversation around data. I almost feel like that could additionally be a call for people to submit information and to make sure that we're getting data from all sources. So how do we make sure that you're getting things from the tribal health system? How do you make sure we're getting information? I think about the HIE, but not everyone's connected to the HIE. I also think one thing that is really going to be important is how do we measure what's not happening in communities and in regions? We did some data in the tribal health system. We have a shared Cerner domain. Not the entirety of the tribal health system is on the shared Cerner domain. But when we looked at that data, we found, not surprisingly, right, that if you live off the road system, you are significantly less likely to have those important preventative screenings, colorectal cancer screenings, well woman exams, testing for cholesterol, et cetera, significantly less likely. So how do we make sure that we're measuring what's not happening, I think is going to be really important. And that perspective from communities about what do they see as a need? And I think that that's one of those data sources that we should be really maybe just starting a list and same thing, website, email, public comment. What are the data sources that we should be looking at together? Because we just talked a lot about data, but we didn't necessarily talk about what are the data sources and how do we kind of come together to collectively measure these things. I think will be really powerful, but also, again, I just worry about how do we measure things that are not happening, and maybe our epicenters at the Department of Health, in the tribal health system, what is happening in maybe APCA and some of the data sources they have. I know the trust does a lot of reporting on behavioral health, but just making sure that we're really getting that data and how do we measure things where maybe people want to go in their applications.
Yeah, I really appreciate those comments. And I think, again, that's a little bit why getting that community feedback to the data is going to be so important, because people's experience may not be captured there, right? But one thing that I did want to just highlight as well is, we've started our first regional planning meetings will be in Seward and Kenai. And that's because Kenai kind of organized themselves and said, we're going to do this, please come. So I share that with the group because we are doing this in response to our application, but also in response to kind of their readiness and moving forward with this. And so it's a good, I don't want to say pilot or test, because we are building out our participation in these meetings robustly. But I think it will be good for us to do this and to see what works really well, what doesn't, and use that to inform future regional planning sessions. And I think everyone will look a little bit different depending on the region. But I say that because we're going in with kind of some data that we have developed using the systems that we have access to here in the Department of Health. I think we need to build those out in future planning meetings, and depending on what region we're going to, like Monique, the tribal data might be more robust than what we have. And so I think every region is going to be a little bit different. But I'm also grateful to Kenai for inviting us and organizing this and being our first. Seward and Kenai are going to be our first meeting location, so we're excited. Monique, anything else?
I think I'll just put, I think folks are excited for those, but kind of back to that communication, if I can just, I think that things are moving so fast. And to Nancy's point, I think it was such a great point about we don't need voluminous things. Some things can just be really short, sweet, concise, is really letting community members know and balancing how we get that information out so that everyone really feels like they're part of the conversation. Because I think that what happens with this sometimes is if folks don't hear about it, and again, really understanding how fast everyone is moving on this, they feel like this isn't for me. And how do we make sure that everybody feels like this is an opportunity for them is really important. I'd rather have people go, yeah, I don't think this is for me, than it was for me and I didn't know. So I think how we do that and how we kind of navigate public notice, emails, that type of thing is going to be so powerful, because we don't have time to go back and try and do it again. So getting it right and really communicating this opportunity for regional meetings is super helpful. It also allows us, as people kind of identify as someone who wants to help, that we avoid any conflicts with big things, right? Summer season in Alaska, everybody's out, subsistence activities, meetings, travel, etc. So just making sure that communication, I think, is going to be really important around the regional planning so that everyone feels like they can be a part of that conversation.
Thank you. Nancy?
Thank you for spending so much time talking about the regional meetings. These have really generated a lot of interest and conversation among folks that we've been talking to. And so we really appreciate your description of the regional planning meetings and their purposes. Like I said, there are some questions that have been coming up. And I'll just step back and talk about some that are a little bit higher level. One is just some clarity about how the regional plans will relate to any future applications or review processes. People are weighing whether and how they'll be involved in these meetings, and I think understanding how the plans will be used in looking at applications will be really important and help them make informed decisions. Related to that, we've heard from some stakeholders, they're wondering about how regional autonomy and independence is going to be preserved in this process and how regional priorities will be respected rather than perhaps being used to advantage or disadvantage applicants in future funding rounds or even this funding round. So I think that kind of information will help organizations and individuals decide how they can be involved.
Those are great questions, and I'm gonna take these for Betsy. So in terms of the use of these in future evaluated frameworks, right, for future proposals. We conceptually had thought, this was 6 months ago, and it probably feels at this point like 2 years ago, right, that it might make sense to have some sort of tie. If you are proposing something, we want to make sure that that fits into a thoughtful delivery plan within the region, right? Because we want to make sure the funds are being used to support that access. Is that this plan? I don't know. Is that something else? I'm not sure yet. Would we talk about that evaluative framework with the advisory committee and have it go under public comment before we include it? Yes. So I think there is opportunity for those ties to happen. I think it will be important, especially in future years, to make sure the projects are tied into a plan that focuses on developing improvements in access, right, and care close to home in their regions. I don't know that would be these regional planning meetings, but I think it's really important for people to come together as we begin to think about how we invest the money that's coming into our system within their regions and to identify, again, areas of alignment where we have consistent gaps or areas where, there's kind of shared strategies. And I'm always surprised when I've attended similar things in the past because And I'm from Juneau, so I am used to living in a small community where we know each other constantly, running into the grocery store, et cetera. But we still don't always know what each other is doing in these spaces or the tools or resources that we have. And so I think there's also value in that because we need to be efficient with our resources and how we're focusing our actions and our time. So I think there's a variety of reasons that organizations would benefit from participating in these regional planning meetings. Again, we're trying to keep it to a day and have it be very efficient. As to how those tie to future proposals, I don't know yet what that would look like. And I think we plan on having a very thorough and public discussion about how that framework is developed in the future. So I wouldn't worry about that right now. I think in terms of autonomy, there are definite areas where we are, I would say, pretty insistent on ensuring that regions come together to talk because we see either kind of parallel systems that aren't connecting at all the points that they could and might have shared funding through the Rural Health Transformation Program, or they're very large systems that are key to how healthcare delivery works in Alaska. And we think that planning is important. That being said, there are other smaller communities that might have very distinct or isolated referral patterns. We want to support them in saying, is this something that you need? Is this something that you want? Do you already have a plan in place? What can we do? And so I think in those situations, it's going to be community dependent. Again, we want to be inclusive and give everyone the opportunity, but we also will respect that some communities, they already have their plans in place. They're highly connected, they're integrated, and we may not need to have the same level of effort as we do in maybe larger regions.
Thank you.
Jared,
Hi, can you hear me okay?
we can.
Great. I don't know the best way to make this comment. And I'm not trying to be negative, but our biggest primary concern that I keep hearing about are really two concerns. Number one, obviously that the money gets invested smartly, and that it's pragmatic. And the second thing I'm hearing about is the desire for, an efficient timeline. And I know you guys are working super hard, so I'm not taking away from that. And I know ACF is. Realistically, it feels like, especially for the bigger proposals, money is not going to be awarded, I would think, until June or July, maybe on this timeline. And I know CMS is looking to do its first round, which, I think this is absurd, but they're looking to do their first round of performance measures in August, is what I just heard in DC. The point I'm trying to make is I appreciate the regional planning meetings. I feel like as a healthcare system, as a state, as a group, we are so interconnected and we work so closely with one another at all levels, that I'm like doing all of these meetings in a way feels like a distraction to me, and I don't see as much value out of it, that I think others think it'll bring. And I just would really, I don't want us to lose focus of getting the money out the door. I think that is just really where we got to be. I just feel like these meetings tend to be, not to pick on an organization, but it's like state of reform. It's like this the same thing every year. And I feel like we're going to run into that in all these communities. And I do think a lot of these regions and areas do know each other and they do know what's going on. And so I'm like, it just feels kind of redundant and potentially not the greatest use of resources. I'm one opinion. I recognize that that's probably going to feel agitating to some, but I just wanted to offer that.
Yeah, Jared, I can appreciate that perspective. I can tell you for as closely coordinated as we are and how much we all know each other and talk to each other, there are some huge gaps in areas of communication within single communities because we have some different systems that don't always talk or align with each other. That's not a bad thing. I think that's natural. That's what happens. But if we're about to invest over $1 billion in the system over the next 5 years, I think it's reasonable to bring entities together to identify what some of those shared gaps are. We have to balance that with our timeline and our resources. So again, we have Kenai and Seward next week. The department is working very hard on the LOIs. We have a number of staff members, and we are prepared to support both without an impact to the timeline. I think from a federal perspective, Alaska, we are taking a slightly different approach than other states are because we are working to get the money out to organizations in communities and in the state, directly. And that's not always the approach that other states are taking. They're putting out RFPs that they are managing to larger entities. They're not doing as much of a direct grant approach. And I would say with the approach that we're taking and the volume that we're experiencing, we are, and we'll talk about the timeline later, we're actually doing very well compared to other states. So I'm not concerned about how we will right now. We have to maintain the pressure. We cannot take our foot off the gas, but I don't get the sense from our program officers or others that we are on the back end by any means for a rural health transformation program. I think we're actually on the front end. And we get a lot of comments, I think, or we hear nationally from other entities that Alaska is moving forward very quickly comparatively. So I know that we are behind the timeline that we had hoped to, but again, since this is the first time we're doing this process and we've had a very high volume, I don't think that it's, I think that we can still move forward very effectively in getting the money out as fast as possible. So I hear the volume balance, and we're working with that. I think Betsy having a full team will really make a difference, and that actually just came together this week. This is the first week that we have a full team. Nils?
Yeah, thanks. Hopefully you can hear me okay. I would like to echo probably Jared's comments a little bit. I think keeping our eye on the ball is a priority for me, getting these grants out, doing that work, focusing on the dollars. I think the regional meetings are a nice to have. I think and appreciate the department's commitment and interest in hearing more from Alaskans and from all these different stakeholders. And it will be important to figure out how that then lines up with future investments that get made. I do wonder, isn't there like a limit on how much of the total funding could be spent on coordination? Like, where does this fall within the budget for the regional planning implementation? And does that affect other choices we might make when it comes to utilizing some of those dollars? So that's maybe just a question. And then the other thing that maybe I heard in some of the comments, I don't know, I think we'll probably want to be really careful about attempts to preserve the status quo. If part of this investment is transformation, I think I'm at least interested in like, how do we do something different that is maybe truly transformative? And yes, we'll have to kind of think through which interests are out there and which priorities do different stakeholders have. And some of that will be for them to protect those things. Part of our job will be to have hard conversations about what's the difference that makes a difference as part of this process. And I would just throw that out there. I think we probably want to be a little bit careful about status quo versus true transformation, and not transformation for transformation's sake, but really trying to make a difference from all this. Thanks.
Thanks, Nils. I think I want to start with something that I think you highlighted, and then Jared, I've heard from you too, which is like, it's okay, like we understand you're doing the regional planning, but we really want you to kind of, again, stay the course with moving through this first funding round. And I just want to be clear that kind of moving through that letter of interest process and moving into the next stage for decisions, that timeline for this round of kind of letters of interest and subrecipient funding is not dependent on what we're doing in the community and regional planning thing. I think that you had heard DC Ricci earlier saying that it would be ideal, right? Our intent 6 months ago when we were putting this together was, well, let's do some community and regional planning so that can be integrated into kind of how we're thinking about which projects we want to fund. I would say that's not for this round, right? That just would be unrealistic to say we're doing this planning process at the same time that your letters of interest are already in. And again, I just would reiterate what I think what we said before is that, the ACF team, worked very, very thoroughly and very quickly on a compressed time frame to handle a large volume of letters of interest and pass that over to the state. And we're doing the same, right? I think that we're working on this compressed time frame to move through it, recognizing that we have this balance between really kind of being thoughtful and taking the opportunities to review all of these letters of interest, and also recognizing that our partners across the state are eager and ready to move forward because they too are aware of the compressed time frame, but also they're ready to go, right? I mean, I think that's what we've heard and have seen from a lot of partners, that people are like, I am really ready to move forward. And we are ready to move people forward too, or we want to be as ready as we can to move people forward as quickly as possible. So I would say the timelines for these two things are a little bit separate. Nels, I think you had a good question too about where does this fit within the budget? How does this line up? Is this an administrative expense? No, this is part of the Healthy Communities Initiative. We've built this into the initiative. We've also built this into our year 1 milestones and our year 3 milestones. So I would say this is also something that we've heard from CMS, that they're really interested in, well, not even just interested, that they have said states will stay to the initiatives and to your approved application like what you put in your initiatives, what you put in your application, that's what the initiative is that you have been approved to do, that they're not willing to add a whole bunch of new things that weren't in there in the beginning. And they want to see us kind of meet some of the commitments that we made that are in there. So I think that we view this again as an important component of the build out of our initiatives. I think that this is something that, if we had been given a planning period, or if we were looking at how do we sequence some of this work, this ideally would have come a little bit earlier in the process and could have been completed maybe, and then before we move into that first funding round. But it's not, right? We're doing this kind of together, and I think that it's going to inform future work. But I don't want you to think that this effort is going to hold up our movement on this first round of letters of interest.
Any other comments or thoughts on this? Okay. As we wrap up again, I just want to make sure we highlight that the department is prioritizing the LOI process and working through that above everything else. So as we talk about these other items, we just know we hear and we feel very strongly as well the pressure to finalize the LOIs and to work through this quickly. But Jerry, Niels, thank you for those comments. I want to move on to the next item on the agenda because I really want to get into the PowerPoint presentation, but we have an item on the agenda called unfinished business. And one area that I would just like to highlight is we had some questions about the stakeholder committee. As you know, for anyone online, the group that we're meeting with today is the steering committee and the advisory council. The charter also outlines a stakeholder committee that is a larger group of individuals. And just wanted to provide this steering committee with an update that we are developing kind of the application for the stakeholder committee. We anticipate putting that forward in May so that individuals can apply, and or if you are an organization that is specifically that has a specific designated seat in the current stakeholder charter, that we will reach out to you and you can there will be a process for sending those kind of nominations for those representatives to the department. But we anticipate that happening in May. I think we had maybe planned a few weeks ago for the initial stakeholder meeting to happen in early June, but I think now we're probably looking at a different date, maybe in July or August. August feels a little too late, so I think we're thinking about July, but when that information is finalized, we will put that on our website and share that. So that's a brief update on the stakeholder committee. I think we'll have more the next time that we meet, and we will make sure that the council and members of the public are notified when those applications open. We plan on putting them on the website using our online notice process for those more general seats, and then reaching out to specific organizations for the specific seats. Any questions on that? Are there any other items under unfinished business that advisory council members wanted to bring up or talk about? Okay, hearing none, we can move to the next portion of the agenda, which is new business. And at this point, I would like to ask, we're going to talk through both the timeline and the process. Oh, Monique, I see your hand up.
Sorry, I'm having an audio issue and I think I fixed it, but under unfinished business, I just wanted to connect a little bit on public comment that the state had on some of the metrics on application, et cetera. And wanted to just follow up with, like, one of the things was not to go back to regional meetings, but one of the examples that we talked about, we spent a lot of time reviewing on the metrics, and I forget the other name of the document, right? Or the other document's name, but how that might inform or what was sort of learned through that process, and how, if that will happen today or at a future meeting. And I think one of the things I think a lot about is because we talked about regional meetings so much was one comment we called out is there's so many regions we use in the state of Alaska.
So thinking about the regional meetings happening, when I think about having a regional meeting in Fairbanks and bringing some of those referral patterns together, Tanana Chief Conference serves an area that would be the fourth or fifth largest state in the country. So when we think about how do we sort of balance regional meetings with some of the communities identified by the Department of Health, how do we start sort of reconciling what regions we're talking about, that type of thing? So curious of, when there's public comment called out, how we use that ultimately, or how the department is using that to move things forward.
Well, I'll start and then pass this off to Betsy, which is that, any public comment we receive, we try to very thoughtfully incorporate into whatever material or process occurs. Sometimes the timing of when we can communicate that out is a challenge. I think I've seen that challenge throughout state government in my time here, but that kind of remains a challenge a little bit. Betsy, do you want to talk about next steps for the public comment related to the evaluation framework and thinking about that for the implementation proposals?
Yeah, I think that we saw some really thoughtful and really helpful comments, both from our public commenters who provided that written feedback, as well as through the discussions with this body the last time that we all met. And I think it's really important. If I were applying to this, I would want to know going into my full application kind of what criteria is the department kind of looking for. And so, and then as someone who it would be, if I'm the person sitting there and trying to understand, okay, how do we make decisions? Which projects do we intend to be able to move forward in this first round? I would want that criteria to kind of tie nicely from an evaluative perspective to the information that's being provided in the application. So I think those two pieces really do go together, which is updates to the criteria, both, kind of that project framework and then that overall portfolio landscape are the two pieces that we've asked the public in this group to look at. And I think that, our intent is to put out kind of an updated version of those and say, this is the criteria for projects and for the portfolio framework that we're going to be looking at for those full applications, those full implementation projects at the same time we open the application, so that you can look at those two pieces in tandem. So that's where I would say how we're intending to kind of update and use those pieces of criteria. But I do think, Monique, to your point, that there's a lot of different ways that you can approach, what is a region, what is balance, what are the areas and components that you need to look at. And so I think that's where, as we've been starting to look at how do we move into evaluation, I think we're trying to look at projects and say, how aligned is this project to the program and to the initiatives and to the goals and to what we've put into that, but then also looking at that balance across multiple dynamics, right? It's not just one. They all play together. And I think it's really important for us to be considering that collectively.
And I think at just a final point, as we go through the first phase of the LOI process, there are things that I think we've learned and ACF has learned about how to make sure that framework fits Alaska's needs too. And that tracks with the public comment that we heard and that the advisory committee shared. And so we want to make sure that we're bringing that into kind of the evaluation framework that will be used for the full proposals. Any other unfinished business under this part of the agenda? Okay, so now we will move on to new business. And Leah, if you wouldn't mind sharing your screen, new business has two elements, a timeline and a process. We've tried to pull those elements on the agenda together into a PowerPoint because sometimes, as much fun as it is to look at our faces, it is nice to look at something else for a while. So I'll hand over this portion of the agenda to Betsy to lead. This PowerPoint presentation is available online as well.
Thank you very much. Leah, if you would move to the next slide. This is, again, just a reminder of the scale of the response. We've received just under 1,800 letters of interest from 864 unique organizations. I think we've shared this update with this group before. But, I think it's helpful grounding to remember that these first year asks really do far exceed the available funding in the program. And so that's where I think as we move through this, we're looking at what can we move forward with now, and what do we think may be a next step? What do we think may be a next step? But we know that we have some choices to make ahead of us, because there are some really, really great ideas and really well-developed concepts in here. Leah, can you move to the next slide, please? This is kind of a high-level timeline and overview to help ground everybody in where are we today, where have we been, and where do we think that we're going. You can see February into March, we had our registration and letter of interest period. There was the initial ACF letter of interest review process that began in March and stretched into April. And we have our partners with Alaska Community Foundation here with us today to talk a little bit about their process on one of the future slides. Right now, where we are is, middle of April in the DOH letter of interest review cycle. We are kind of taking the materials prepared by Alaska Community Foundation and then doing our own review on top of that too. And we hope to move into next steps for that first round of letters of interest in, like I said, in early to mid-May. There's 4 different pathways that we could see. We could see kind of moving into readiness awards, planning awards. There would be a time frame within those awards where we'd say, we would like to offer you a readiness award. We need to work with you to gather a little bit more information around some specific budget details. We may need to do some CMS review. I think it's helpful to recognize that when we talk about what would that CMS review look like, that's where a lot of the questions that we've received from applicants so far have been things where we've said, wow, we need to go back to CMS and understand specifically how that could or couldn't fit within the program requirements, right? And, to some extent, we have more information and more answers than we did when we started this process, but I think there are also still a lot of questions. Some projects may be really straightforward and we may not have those more detailed questions that we need to kind of work out with our federal partners, and in some areas we may. I think that's just something we wanted to kind of prep people for, that if we have questions around your specific project, there may be a need to go back to CMS and ask them some questions about that too. I think it's helpful maybe for people to recognize that our current understanding is that the CMS review is more around, the department is reviewing and deciding on, and the commissioner is deciding on, is this project that's aligned, something that we want to move forward with. And CMS is helping us understand, are these various components allowable? Are these various components aligned to CMS's understanding of what our project is? So it's not that CMS is necessarily in there saying, we like this healthcare access aligned project more than this healthcare aligned access project. They're really there to help make sure that overall we're meeting the program requirements, we're meeting the funding expectations as far as what we can and can't use these funds for, and to help ensure that what we're proposing to move forward with really does align with their understanding of the application that they approved. So readiness awards, planning awards, we also anticipate opening that implementation application cycle for letters of interest that advance to that stage. That would be we're looking at approximately 3 weeks beginning in May. There also could be at this stage projects that we either, decline because maybe it's a project that's been proposed that might be a great idea, but doesn't actually align with the initiatives. We want to let people know on the front end if we can and say, this doesn't appear to be aligned with either the initiatives or perhaps the allowable uses of funds that we know we have going. And we want to give them that heads up now rather than saying, this is a great idea. We don't anticipate having available funding for it. Please come back again in a future cycle for reconsideration. That would be a deferment. But given the volume of awards that we have, and really the time that we know that it took for our community partners to prepare the information to provide, we really are hoping to kind of provide helpful responses back so that they can understand what the most likely next step for their project is, or kind of what the viability of their project is, or is this something that aligns. For those implementation applications, we anticipate an application review period beginning in June. I'll say you don't see firm dates on here because a lot of this really does depend on a little bit on the volume, right? And I think that as we move through the letter of interest process, as DC Ricci mentioned earlier, we're learning a lot about ways to approach our review, and we're really looking at this through the lens of how can we be thoughtful and thorough, but also not take longer than we need to, because we know that our partners are really ready to go too. So we are always looking for ways to move faster, recognizing that we are still balancing that with our responsibility to ensure that we're being thorough and really evaluating the work that people have put in to their applications. So that's where we anticipate likely in June that we'll start to move into those implementation award cycle and responding back to people to let them know. You kind of see that bar stretching into July. I think that again is just meant to signify that that there may be a question process depending on what's in there. It could be, especially, I think we've said this a number of times throughout this cycle, but understanding what is allowable and what isn't allowable within the renovation space is something where we do anticipate needing to work with our CMS partners and saying, this is the project, we believe this is allowable, we want to make sure that this aligns. And there may be other areas too where we have a little bit of that back and forth. But we are, again, committed to moving as quickly to decision as we can. This slide 4, shows a little bit of a kind of spotlight into the letter of interest process, so the front end of that cycle. We're here in April. You can see the green highlight around the stage that we're at now, which is that Department of Health review. Again, this is just kind of a zoomed in look at what we just discussed on the prior slide. So we have our registration letter of interest where our applicants are engaged. Alaska Community Foundation took the next stage of this cycle, and now we're here at the Department of Health review and are looking to move forward with the readiness and planning implementation next steps, as well as responding back to letters of interest if we know that they're not aligned, or if we recommend that they defer and apply again for reconsideration in the future cycle. And at this stage, I'd like to pass this over to Alex McKay with the Alaska Community Foundation, and she can share a little bit about the review process that ACF engaged in to get us to this point.
Okay, great. Thanks,
Alex?
Betsy. And yeah, hi everyone.
Oh,
Thank you.
Alex, you're very
Nice.
quiet.
Oh, am I? Ooh,
Yeah.
sorry about that. Uh-oh, let me see. Sorry. Let me get this turned up. Is that better?
Yeah.
Okay, I'll turn it up even more. All
Yeah,
right. Well,
it's still a
anyway,
little quiet.
oh gosh, okay. Thanks everyone. Good to be here. It was really quite an honor for the Community Foundation to become the grant administrator for the Rural Health Transformation Program. We worked with the state in different capacities over the years, and the Department of Health in particular. And we really appreciate the responsibility that we've taken on for a program, of this scale and consequence. When we became the grant administrator, in order to be true to the kind of intent of the program, we looked back at how the proposal was put together. Before the notice of award was even, notice of the opportunity was even released, the Department of Health issued one of the earliest requests for information in the country. And in response, I think there are over 160 organizations submitted input that represented over 400 projects and recommendations. It spanned tribal health organizations, providers, just really ran the gamut. And so the program design really came from the field, not really just from the state agency working in isolation. And some of the members of the advisory council were actually part of sort of an advisory group that kind of informed that as well. And so we really wanted to bring that similar kind of Alaska grounded approach to this program. I built a dedicated internal team with deep program and grants experience that were fluent in Alaska's health and nonprofit landscape, and had the capacity to review LOIs from across the state from many, it turned out to be 864 organizations. Joining me today is one of them, Desiree Jackson, our senior fellow for Rural Health Transformation Program. She brings she has deep roots in Alaska. The Native Health Tribal Systems through her work at ANTHC, South Central Foundation, Search, and the Alaska Native Epidemiology Center, and most recently was the executive director of Gold Belt Heritage Foundation. So really bringing a wealth of broad experience. In addition to our internal team, and there's a team of 5 that you may meet at some point, we actually put together a proposal review team, and you can kind of see it on the left side of the slide. We knew that a review of this consequence required more than just us. So we convened this team drawing on Alaska's broader philanthropic community. The participating organizations that joined us are Alaska Mental Health Trust Authority, Bethel Health Community Services Foundation, Bristol Bay Foundation, Juneau Community Foundation, Matsu Health Foundation, and Rasmussen Foundation. And together, that's decades of on-the-ground investment in Alaska's communities with a lot of knowledge about many of these organizations that have submitted proposals. And so it means that the recommendations that we made and brought to Department of Health really reflect a philanthropic viewpoint, not a single organization's judgment, and certainly not my judgment alone. The program review team really went beyond kind of just the straight review. We all took a look at them, we divided them up, and we came together for deliberate discussions to kind of interpret proposals collectively and talked about it. We surfaced themes, we worked through areas of alignment and ambiguity, and it really created space for contextual knowledge to surface, any assumptions to be tested. And so our recommendations that we sent to the Department of Health reflect kind of an individual deep proposal look and a portfolio view. I think one of the things, and I'm sorry, I think I'm taking up too much time now. Since the application to CMS wasn't a generic rural health proposal, the state clearly documented the specific conditions that our geographic isolation, our off-road and extremely remote communities, workforce gaps, the hub and spoke architecture of our tribal health and other systems. And really that's what the federal government, supported. And we did end up with this very large first-year award. And so that's what we really tried to address, all of those factors, and it shaped every dimension of how we approached the work. I'm going to turn it over to Desiree now, who's going to walk through how that review worked and what we found. Desiree?
Good. Well, let me do a sound check. How do I sound, everyone? Can you hear me?
You sound good, clear.
Oh, great. Thanks so much, Emily. And thanks for the intro, Alex. As a subject matter expert and someone who chooses to raise my family in our traditional homelands of remote and rural Alaska, being part of the rollout of RHTP funding initiative and ensuring it's impactful for our state is a huge honor, not only for me. I say this on behalf of the 10 other reviewers that spent countless hours reviewing and providing feedback into where we're at today. Today, like Alex said, I'm going to walk through how the review worked, what we assessed, what we found, and how that informed our recommendation to the Department of Health. ACF reviewed and received, as you've heard, over 1,795 LOIs from 864 organizations. About 4 out of 5 of those applicants were Alaska-based, or that 81% that you've seen earlier. And what we ended up doing as reviewers, we ended up organizing by initiative area and by type of applicant. So proposals were reviewed by people with the right expertise. When proposals were more complex, we went ahead and assigned multiple reviewers, and that way we got multiple perspectives. Separately, we conducted an overall portfolio level review to look across the full pool. We did this because it helped identify gaps such as underrepresented regions, communities, populations, or initiative areas. So we really wanted to look at that full spectrum of what we got in this initial pool. Every letter of intent was received across four core dimensions. So we reviewed them, we received them. We looked at eligibility, and you can see that on your slide. We looked at alignment with our HTP priorities. We looked at feasibility of approach, and we looked at organizational readiness. And then beyond individual proposals, we looked at that portfolio balance again, where the project would operate, which RHTP initiative area it fit into, who it serves, and the type of provider. This ensured the overall state slate reflected Alaska's full geography and health system, not just the strongest proposals reviewed on their own. So really, again, just want to emphasize the balance of the portfolio. For us, alignment focused on the relevant RHTP initiative areas, potential impact on the intended community, increased access to care, clear understanding of need, and feasibility. Strongly aligned proposals were often community-led or community designed, built for Alaska's specific geography and remoteness, and designed with on-the-ground realities in mind. We all know how hard it is to work in remote and rural Alaska. Less aligned proposals tended to expand into new areas without partners. They focused on equipment purchases without a clear program model, or they were imported approaches from elsewhere without Alaska-specific adaptations in mind. And what we found overall were proposals fell along a spectrum of alignment. On one end, we had projects that were deeply rooted in their communities, have strong partnerships, and are ready to move forward. A lot of people are calling this nationally shovel-ready projects. On the other end, we saw promising concepts that need more planning or development. And so for us, the challenge was not identifying quality. The challenge was there were far more aligned fundable projects than there is capacity to fund in year one. And to address this, ACF organized proposals into three pathways. And you can see those pathways listed on the bottom of the slide. We organized into readiness, planning, and implementation. This helped align each proposal with the most appropriate type of investment based on where it is today. A proposal's placement informed ACF's recommendation to the Department of Health. And the Department of Health is really that organization that is making all those final funding decisions. RHTP is intentionally a multi-year program designed to support organizations and as they grow and strengthen over time. Nationally, what the conversations that I'm hearing, a lot of these first year projects that are coming forward are really these, shovel-ready things that people already had in place. I know there's been talk of, having more dialogue and forums. A lot of that is, so that we can potentially see what comes from partnerships and bringing ideas together to maybe see more transformative, complex ideas in the future. But, that's really what our process entailed. And at this time, I'm going to hand it back over to the state.
Thank you, Desiree. And thank you for kind of the overview of ACF's work to date and the portion that has kind of brought us here. And, I think now we're at the stage where the department is conducting our review, and the slate that we've received from ACF has been an incredibly valuable analytical input, and it's an important reference as DOH moves into our review. I do want to share with the committee, you know, at the Department of Health level, we're also reviewing each letter of interest. We're surfacing themes. We're looking across portfolios because I think, you know, it's really helpful for us to have multiple layers. You know, same that ACF has highlighted, that looking at this body of ideas and this body of work from multiple lenses and multiple angles with different lenses is really helpful as we look at what is the body that we would like to, or the slate, I suppose, that we'd like to move forward in this first round. So we've convened a review panel at the department level as well. You know, that includes leadership from across the department. We have, you can see, you know, listed here a number of the individuals or types of individuals that are engaged in this review of all of the ideas that came in. We're looking at alignment, impact, readiness. We are also looking through different portfolio lenses to look at balance in different areas. You know, and a lot of that is informed by that portfolio review or those portfolios dynamics that we put out for public comment and receive feedback on from the advisory council. I think having that public feedback and advisory council input into areas of import and areas to you know, recommendations for areas to highlight as we think of what are we looking for in those full applications is really helpful for us as we review this stage, which is really meant to kind of identify those projects that we think are ripe to advance to that full full application implementation application process at this point. So this group is reviewing right now and will provide final recommendations to the commissioner, and the commissioner will be the one that reviews and makes the final award decisions, as well as determining next steps for the various letters of interest that we've received. And then finally, this is just a reminder as where you can find, where the public can find more information about this. I think we've talked about updates to our website, opportunities to reach out, let us know about regional planning if you're interested in getting involved. But again, as we've shared, we'll be putting more information that's specific and detailed around that on our page, but this really is where we intend to kind of drive folks to learn more about what's the current status and what can they expect next.
And also some of which I think you guys have heard before. So I want to pause and give everyone a chance to ask some questions. Again, we're in the middle of the process. So some information we can share, some information we cannot. And Monique, I saw your camera change, but I didn't see your hand up. So does anyone have any questions? Hi, Representative Mina.
Hi there, just a quick question. Does ACF have the ability to work directly with CMS to get input on answers, or does ACF have to work through DOH to get to CMS for clarity?
The relationship, you know, as far as kind of program questions, is really from DOH to CMS with our partner. We have a program team at CMS that we meet with very, very frequently. And we're in constant contact with them, but the communication does flow through the department.
The department is it really is that state agency that was identified for the grant. And so the ultimate responsibility for the program overall rests with the department, and we manage those communications back and forth with CMS, similar to how we manage those with Medicaid or other programs. Nancy?
Thank you very much for this overview. I have a really practical question. Some proposals were designed around implementation windows that depended heavily on Alaska's summer and fall seasons. As the review timeline is extended through much of the summer, and that season may have passed by the time awards are made, how are you regarding proposals that were season dependent in their original design?
That is a good question. I think what I would say to that is that when we move into, right, I think when we move into the next stage of this, especially if you're thinking of something where the funding may come sooner, such as for a readiness or for a planning grant, although I think the situation that you're describing is maybe more applicable to some of the implementation grants. What I would say, and this is off the cuff, so someone may tell me that I'm over promising, but I think that what we want to think about is with that notice of advancement to the implementation application, if an applicant says, look, honestly, the time window for this has passed by and it's not going to be realistic or practical for me to engage in this work right now, I think that there's an opportunity for them to almost do their own deferment and to say, I'm choosing not to submit my full application in this round. I do think it's helpful. I know we've talked about timelines a lot with this group and a lot with the public, but I have to continue to remind myself that our year 2 process for this cycle begins this year, right? It begins October of this year. And so I think that, some of this is we're trying to kind of make thoughtful decisions, but we're also really looking to our community partners to kind of self-assess and to say, okay, if I could have started this in February, I would have been able to go. Recognizing that maybe I won't be, obviously we can't start this in February. If I could start this in July, can I still go now? Or can I say, I'd really like to have a bite at the apple for next year because it's not going to be realistic for me to do that this year. There may need to be some of that self-assessment. But we recognize that like everything, Alaska is so season dependent and so cyclical, and that is a really major component of the work that a lot of people want to do.
One thing that I would add is that we don't have a final time frame for when the next round will open up, but we do anticipate like late summer, early fall. So because the cycle will move, I mean, again, we are in an off cycle for year 1, and we are moving as fast as we possibly can through this. But the cycles will occur in the late spring, early fall in the future, with that award to follow in October. So I think that will help entities be in a better place for those spring construction projects when we move into that normal cycle. This first year is just that off cycle period. Monique, did you have a question?
I think I think what I would see as an important task for the advisory council going forward is looking at that timeline. I think it was on slide 3. And is there any opportunity and I know there's not much of an interim, and as fast as the state is working, so are applicants, right? So, for example, I'll use AMTHC as an example because I'm familiar, right? Like, we are not counting on any, some of the projects, do they move forward with this funding or don't they? Because we really tried to kind of put things in that we were sure, barring any real guidance from CMS, unfortunately, on the extent of renovation, right? Like, I think I'm really concerned about applicants because they're going to maybe be trying to figure out how to implement an award while they are also trying to implement other things that were a priority, that had to move forward, regardless of RHTP funding, right? Like, we could not just say, well, we got to do this. So, fingers crossed, hopefully we'll get the money. Those things are moving forward. So I worry about organizations that are trying to make the most of this money, especially thinking about our smaller, really rural frontier providers, what it takes to get stuff there. As Nancy referenced, there's a lot of seasonal things. These are not small tasks for the applicants to undertake. And I try and channel some of the comments I hear from folks and through different, meetings, and how we really make sure we don't leave the smaller providers, communities behind, because they are even more, right? It's hard enough to get stuff to Anchorage. Now, let's say we're trying to get that to Kivalina. Now, let's say we're trying to get that to fill in the blank. And I'm worried about that timeline. And I think if there's any opportunity for us to year one, put the pressure on CMS. I see they're on the timeline. Their review, applicants only having 3 weeks to turn around and do an implementation. Really worried about the timeline, and would really like us to, once the first year awards go out, is how can we look at that timeline? What's the lesson learned, right? Like hearing from the department and HCF about all of this and that process, and did it really parse things down for the state? Because it was still a lot of work for applicants, right? And they know, I heard from applicants just being concerned about how much time am I going to have, because my letter of interest was hard enough in the time frame. So I really, if there's an opportunity for us to look at that timeline for out years and how we can take off some of and I think from not only the state, but ACF, but also applicants, in terms of what they learn from this process and how we can move that forward so that we can spend the money. Because a lot of organizations also have kind of robust approval processes that they're considering for their own organization to move forward. So at ANTHC, we do not move forward with capital projects that exceed $1 million without approval by the board of directors. So if we're teeing that up, at the end of April is our board meeting, and how do we get that approval for things that we're not sure about yet, so it doesn't slow down the spend? And I think this is something a lot of organizations are probably wrestling with in that time frame, and thinking about how, because we've talked about initiatives like regional planning meetings. It's important. We said we would achieve it. This is how CMS is grading us. CMS is also grading the state on the ability for awardees to spend the money in a timely manner. So how can we improve our processes and make them as smooth as possible for all involved, for the people reviewing, for the people developing, for the people building and implementing awards? Is how do we make sure that we really can spend this money and we're not a state turning money back to CMS for other states to spend? So I think there will be an opportunity for us to think about that, right? Like, not a lot of time to do that, but I think it's so important. I think I have to raise it now, is like, how do we do that?
Monique, thank you. And actually, that's one of the items that I wanted to talk about before we left the advisory council. Was we do want to bring everyone together when this is done at an AC meeting and talk about, so we can share back what we've learned. We've learned a lot. And I just want to put into context, we're about 4 weeks behind, but we're looking at an 8-week turnaround for this initial phase, right? Maybe 12 when we do the applications. Like, it is an incredibly fast time frame for grants. I think about the grant process within the state or other philanthropic organizations, and you don't see timeframes like this for turning around this amount of money to this many organizations when everyone is building their team. So again, I know everyone is working really hard to utilize this money, but I just also want to have a little bit of a reality check about where we're at and how far we've come. But I say all of that recognizing that, like, from an Alaska capital and construction perspective, this timing is about the worst it can be for planning purposes. Like, it does not work in our state. And I'm actually really glad that we're moving into like a late summer, early fall timeframe, because I think this issue will resolve itself very soon. But for this year, we're going to have to work really closely with entities that have projects that are planned, to make sure, again, that with the timing for this first year being so off cycle, that we try to make it work. I think the other thing too that came to mind is one of the reasons that we have this letter of interest process is to try to make it easier for smaller entities so that they were able to participate without having to complete the full hefty application that you might typically see with this. And so I think it'll be interesting to get feedback this summer about whether the approach we took achieved that and reflected that. And I think it'll be easier to know that after we see the implementation application, right? But in my experience in the state, we've done historically a really good job of asking for like, I don't know, 100 to 300 questions with really intense information whenever we want to try to understand like whether or not we're going to fund this project. And it is intense to review and it is difficult for applicants. And like, I don't know that more volume always equals better quality for the reviewers or for the applicants. So in some ways, this is a little bit of a different process where we're getting less information at the first stage and then more information as we work through. And I'm eager at the end of this for us to talk about what parts of that worked, what parts did not. I'm sure ACF has a number of lessons learned through their process. We certainly are as we're going through it right now. And so I think we need to do kind of that hot wash for the advisory committee afterwards and get public comment as well that we can think through and react to before we begin the next phase.
Add to that, Deputy Commissioner, thank you. I appreciate that. And, I think what might even be good is if, like working with ACF, if we convened actual applicants, right? Like people who submitted an LOI and then went through this whole process, like invited them to a meeting to share their feedback. And because us having a conversation, right, the advisory council or the steering committee, helpful. But let's hear from the people that really were sitting at the computer trying to do this. And what were their lessons learned? And especially, I think those smaller orgs that I really feel are like the purpose of RHTP. And someone I always try and consider is if I were in a small community off the road system reliant upon, a charter plane or something weather permitting, or do I live in a community where 12,000 pounds of mail is sitting in the next hub community and just can't get here? Is really hearing from those organizations specifically and inviting them to a meeting. So I think that's, as I think about the charter for the advisory committee, as how we can help the state with that strategic planning, implementation of these dollars is, how do we help with that burden for all involved? And, I think it's, just acknowledging the time frame everyone is under, and certainly the Department of Health, certainly ACF, and certainly applicants of the money as well. So how do we do that in the least burdensome way, but in a really informed, thoughtful process that we ensure we're not risking future awards from CMS? But I think there'll be a lot learned from all parties. If we did it perfectly, we probably have a business model that we could sell across the country, because I'm sure all states are wrestling with this unless they are going through some different processes that I've read about that sound like something that would not work for Alaska and call into a whole lot of questions for me. But I think hearing from the applicants would be really powerful as a member of the advisory council.
And I think to that point as well, thinking about the stakeholder committee and how they could be maybe a powerful voice in this space too, once that is stood up. I think that's another route, Monique. One thing I also just wanted to highlight publicly and for this group's awareness is we still do not have the reporting templates for CMS for ourselves or for the subgrantees. Now, we have seen previews back in February of what those reporting templates would be. And we hear that they are going through their final review. I think it's with like federal OMB. I am not sure, but they are going through like the final internal review that they need to at the federal level before CMS can release them. When we get those, we will share those and we will be incorporating those into the reporting requirements. And I'm personally, I have fingers and toes crossed that those will be released very soon so that we can include those with the implementation application and people can see very clearly. But I just want to highlight for this group something that we're going to have to manage over the next few weeks is that we actually don't have those released from CMS yet. And so we will do our best to channel that. We will share everything that we know, but that's just something else to be aware of because I know that's also an issue that organizations are going to be tracking closely. We've got about 9 minutes left and one more item on the agenda. Are there any other questions about what we discussed? Monique?
Commissioner, I just have one more question, and maybe ACF can share with us at a future time, are the things, and that's probably after the Department of Health's review too, are there things that you saw in your review process that were like, man, I wish we could have done that, but it didn't really maybe meet the intent of the RHTP, but it really would have driven health outcomes for those living in rural and frontier parts of our state is, sharing that back to the advisory council, because I think many of us, not only on the advisory council, but the forthcoming stakeholder committee and just in general, people that are really involved in this, are trying to help create opportunities for states like, well, I was going to say Alaska, but there really isn't one, but to help these dollars be more utilized in the parts of this, not only the state, but types of projects, thinking about that really limited view on renovations potentially that we're going to see from CMS, but how can we help advocate potentially through our various organizations for additional flexibilities or program types that potentially we could help advocate for to change at the federal level. I don't necessarily want to take this as just the hand we've been dealt by CMS, but I think we continue to advocate for things in the tribal health system to say, when we meet with folks at the federal level to say, hey, you need to take a broad interpretation of renovation in rural Alaska. We know Administrator Oz is not a fan of buildings being built based on what we've been hearing, but that would be really transformational for a lot of communities is if they could have a clinic or they could have a provider there more regularly. So some things that might not be transformational from the perspective of someone sitting outside of Alaska would be incredibly transformational. So I would love to hear at some point ideas that were just really great, but not a good fit for RHTP, and how we might either be able to, one, direct those applicants to existing resources that we see, lots of foundations involved and opportunities, the Mental Health Trust Authority, those types of groups, so potentially continuing moving these things forward. So I don't want to lose sight of great ideas that have really come forth from regions and communities so that we can potentially make those happen.
Yeah, and Alex, I don't know if you want to respond to any of that in terms of what you've noticed, and then I can just kind of provide some kind of wraparound comments about as we move forward, what we think some of the next meetings will be and how those relate, Monique, to what you just raised.
Yeah, those are great suggestions, Monique. And we are gathering, from the review committee, proposal review team, what were the challenges, what didn't quite fit, what didn't fit given the proposal that we submitted in our unique, aspect of Alaska. And then we'll meet with the Department of Health. I think we're going to all probably consolidate whatever we've learned and see what we can do. I do think that every round we're going to be improving, so I think that's just a part of the process anyway. But more to come.
To kind of build on that, there's a couple of roles that I see or kind of immediate needs that from the department perspective, we could really use help with from the advisory council, right? One is what we've talked about, the process input, the feedback to improve things and how we shape that. The other, of course, is going to be the evaluation framework that we use in the future that will be a little bit reflective of the process and where we're at. But then the third is we know there's a lot of interest in the different ideas that have been submitted. Not all, many were not aligned with the RHTP, many were. We think it's going to be valuable to share those ideas so that everyone can see kind of the totality of Alaskan interests. I think we want to make sure that we're through kind of the deliberative stage. But we do intend to make the letters of interest and the high level summaries available publicly so that people can see kind of what the ideas are. And I think, Monique, that will help inform the conversations about where those gaps are, because I think it becomes a little clearer when you can see them and you can see some consistent themes, and we can discuss maybe ways to help fill those gaps. The other element that we're going to need to work through here pretty quickly is if we see, for example, 5 different organizations want to purchase the same piece of very expensive equipment, right? And that equipment may be really appropriate for organizations in those circumstances and may be important for them to look at. I think from our perspective, we want to make sure that if there's opportunities for efficiencies in purchasing so that we can get better pricing or better deals, that we're using this opportunity to align and to leverage those. So I think there's going to be a lot of things coming out of this that we talk about, with the advisory council and with other stakeholders about how do we make sure that where there's alignment, we're getting the best value for our dollars and for our investments, and the people that are accessing those get the best suite of services for the most appropriate cost. And I think where that balance is going to be important over the next few years. So those are some items that I know we want to talk about next. I think moving into the next agenda item for closing items, next steps and actions, I would propose that we work to identify the next meeting time for the advisory council. We are about a month from the last meeting, and I think in these early stages, I would recommend we have another meeting probably about a month from now as well. If there's specific, depending on the timeline, if there's specific periods of time, we will try to align that with the advisory committee, because this is a really, I think, useful way to share information out publicly. But I would propose that we try to meet sometime within the next month, that I would open that up for feedback from advisory committee members.
I agree. About a month sounds good.
Okay. I'm hearing thumbs up. Are there any other next steps or action items that committee members want to raise? Monique?
One thing that would be, all right, we talked a lot about the regional planning meetings as one of the initiatives in the state's application, but there were quite a few others that we've listed, and I think it would be helpful for community members to understand how that work is progressing around provider shortage, provider need, some of those type of items. And I think so I would love to see that on the next agenda. And I think what would also be powerful on the next agenda is if we could hear from maybe a participant or two, maybe one from each of the Kenai and the Seward meetings that are scheduled, to hear how they went, and any valuable insight, things that they wish they had, things that really went well, lessons learned, opportunities moving forward, so that other communities that are thinking about hosting these meetings have the opportunity to kind of learn from what other folks who have convened. And also, as part of that, just hearing a little bit about the state's process in terms of who's leading the conversation. Is there a facilitator? The data, what are the other future meetings? Some of those things kind of around regional planning, but also the other initiatives, I think, are ones that are really important for us to start talking about.
Thank you, Monique. Good ideas. Any other thoughts on next steps? Okay, any other items before we adjourn? Hey, thank you all for your time, your expertise, and your commitment to this process and to helping us as we implement this and improve rural health in Alaska. If there is no objection, we will adjourn the meeting. Are there any objections? Okay, seeing none, we will adjourn at 10 o'clock on the dot. Thank you all very much.
Thank you.
Thank you. Bye.